So when I was first appointed to the hospital, I was also in the regular army. And then I subsequently left the transferred to the reserve, but stayed living locally and continued working as a visiting anaesthetist at the hospital. The uniform is a blues uniform. It was once an issue uniform. It's changed now. It changed about 30 years ago. But if you notice the funeral of Margaret Thatcher, you would notice that some of the British regiments for that ceremonial occasion still wear this uniform, but it has gone out of the Australian Army.
Anzac Day is a day when we remember those who have sacrificed their lives, Australians who have departed Australian shores and sacrificed their lives, particularly in the context of World War I. Like many Australian-born, members of my family have served with Australian forces. In World War I, my grandfather had departed from South Australia as a reinforcement with Australian Light Horse. And then in World War II, I had two uncles, both who provided service constructing airfields in Papua New Guinea with the Royal Australian Air Force. I was an undergraduate with the Adelaide University Regiment, where I learned a range of infantry skills, doing at the same time undergraduate medicine in Adelaide University. On return of completion of my surgical training, I then came back into the reserve as a surgeon at 3-4 General Hospital, which was a South Australian-based reserve health unit. Moving to Sydney in 1990, I was approached by a parachute surgical team and joined in 1991 as a surgeon with the parachute surgical team based out at Holsworthy. With that unit, we provided the health support, intimate health support to the airborne group, and would deploy with them on peacetime training activity broadly anywhere in Australia that airborne group deployed. So we'd go in by parachute to areas like Wyndham or up in the Northern Territory or places like Borroloola. Subsequently, there were operational deployments with the tsunami on the northwest coast of Papua New Guinea in 1998, and then other formed elements. Part of that surgical team went into Banda Aceh following the Asia tsunami on Boxing Day of 2004. Liverpool was Australia's fourth garrison city in its neo-colonised history. So a little over 220 years ago, Liverpool had a garrison. There was hospital support to that garrison provided on this ground, and in World War I, large numbers of troops that trained in the Liverpool area as part of the Australian Imperial Forces received their care here, and a number of nurses and doctors did leave from Liverpool Hospital to provide support through World War I. With the subsequent wars, a number of returned soldiers were treated here, and a number of staff trained here and deployed through World War II, through Korea, through Vietnam. Most recently, we've had reserve specialists in Rwanda, in Bougainville, in East Timor, in Banda Aceh, in Afghanistan and Iraq. And currently at least 7 of the medical specialists on this hospital staff are anaesthetists, surgeons, intensivists, emergency physicians who have deployed in those recent operational activities.